My niece, she is in active addiction. A friend of mine that I grew up with overdosed and died. Opioid addiction is everywhere. You never know who it can affect. I lived with my mother, a lot of physical, mental abuse, a lot of drug and alcohol abuse. I was a dope girl, so I went to federal prison. When I was in federal prison, I realized that God had a plan for me, and it was definitely not doing what I was doing.
I was using opiates. I was using heroin. It took everything away from me. Not being able to be there with my son, not being able to be there to watch my daughter get married. I just lost myself.
The opioid crisis has destroyed lives. It has destroyed families. It has taken people completely out of the economic engine in many ways, and it's really tasking us as a community to respond.
Here at Care Alliance, we're definitely trying to unveil and take the mask off of this monster of opiate addiction.
Somebody who comes in who's suffering from opioid addiction won't just get drug and alcohol counseling. They're going to get primary care, they're going to have access to dental, access to care coordination, access to counseling. We really treat addiction as a primary care issue.
You're kind of hesitant to go into a situation like that, like when you haven't been like medically in a situation like that for so long. You know, you put it off, especially when you're using. So they welcomed me, it was great. Just made me feel comfortable about being able to tell them things that I needed to tell them.
Care Alliance is amazing. The staff there has made me feel so welcome, especially the nurses and Jessica.
Care Alliance has stepped up to the plate and giving us the opportunity to provide addiction medicines services.
Currently we are using Vivitrol, which is an opioid blocker. So for patients like Maggie and Claudine, they utilize Vivitrol with us as just another tool in their tool bag to help with their recovery.
When it comes to cravings, thoughts, like dreams, all that, it's helped me with, and I hope to keep getting it.
People come from hours away. They drive here 2 hours, 3 hours once a month. There's such a need in our community for people to continue to work, to continue to get back to their lives, to rebuild.
There are many great resources in the community, and we really work hard to reach out to our partners and make partnerships and make linkages, because the death toll for opioids is just gigantic.
The Adams Board really brought us to this table, and we're grateful for that because they saw that there was a need and they saw that we could serve that need. I know we're honoring Bill Dennehan, and I think it's for good reason.
I would like to tell Care Alliance thank you so much for making me realize that my life is worth it.
Because of Care Alliance, I've been able to start a new life.